are back with another video in our one-on-one with a physician series, and today I will be interviewing Dr. Newman, who is a general pediatrician here at Children's Mercy in Kansas City. So, hi, Dr. Newman.
Hello, thanks for having me.
Of
Appreciate
course.
the opportunity to be here.
Of course, thank you for doing this interview.
Of course.
So I am going to ask you a few questions about you and your experience and what brought you to where you are today. How does that sound?
Sounds great.
All right, perfect. So, first off, what do you do here at Children's Mercy?
So my main job is I am the director of the pediatric residency program. So when you look at how my job's broken out, about 80% of my time is dedicated to that role. And I can talk about that for hours and hours on all the responsibilities and all the fun that is being the residency program director. Then about 20% of my job is clinical, where I see patients in our general pediatric clinic. And so I work in our division of general academic pediatrics as a general pediatrician.
That's very cool. So was going into pediatrics and being a general pediatrician, was that always your first choice?
Probably not, right? Went to medical school because I liked science, right? Liked the pathophysiology and how disease plays out in people. And I think a lot of people at some point, if you like that part of science, you end up either kind of on a PhD route or even down a medicine route if you like interacting with people and working with patients and families on a day-by-day basis. So I knew I liked that. Made my way to medical school kind of on that as the background. And then I remember going through my clinical rotations, right? Traditional third and fourth year. And it was more what I didn't like that got me to pediatrics to realize what I did. I remember doing surgery. It was like, this not for me. My ADHD is way too active to sit still in a sterile environment for that long. And psychiatry was a lot of talking, at least from my perspective. And ER was a mix, but just wasn't for me. And it came down to I liked medicine, right? And for those that may not break that down the same way, I liked the pathophysiology of pneumonia and cellulitis and primary care and those kind of pieces. And at that point, that's what patients do you want to take care of. And for me, it was easy to want to take care of kids. Kids are pretty helpless. They need support. They need somebody advocating for them. And I was always glad to be the one that got to advocate for the kids. And you flip that, the adult side's great too. If you like medicine, adult medicine is similar to pediatric medicine. There's obviously a lot of nuance and differences and some things that don't line up together. But the idea that you could go work with adult patients or work with kids, working with kids was a no-brainer for me. So I ended up with pediatrics near the end of my third year, dedicated my fourth year to every rotation my school would allow me to do in peds. I kind of confirmed that decision and then landed in peds residency.
That's amazing. So you kind of answered a couple of my next questions already.
Jumping ahead, I'm good.
So I was going to ask you, why do you think someone should choose pediatrics or why not?
In general, you're talking about like what career path you should choose. Find what works for you, right? I don't know if I can convince you to be a pediatrician if you don't want to be a pediatrician. I probably shouldn't. Figure out what is going to make you excited about going to work. What's going to make you excited about new journal articles out, have to learn this new guideline or this new process. And if that's pediatrics, great. Dive in head first. There's lots of opportunities in pediatrics, not just being a pediatrician or a subspecialty pediatrician, but going through things like dermatology and being a peds dermatologist or anesthesiology and being a pediatric anesthesiologist. Find that career where you're willing to read that next journal article, or you're thinking, I'm going to get paged at 2 o'clock in the morning on a Saturday. What do I want that to be about? And if that's pediatrics, great. If that's something else, that's fine too, right? That's what we're doing all this is to figure out what careers we should go down.
Yeah, absolutely. So now I'm just going to switch gears a little bit. So what do you think was the hardest part about medical school for you, and what was the most rewarding or enjoyable?
I'm pretty old. I know I don't look it, but thinking back to medical school, what was the hardest part? I think it's hard in medical school. I think it's also hard in residency to know what the outcome looks like. You're so bogged down with, I've got this test next week, or I've got all of this stuff to memorize, or there's only 24 hours in a day. I need X amount of hours to sleep. I need X amount of hours to myself to recharge your batteries and to support your wellness and all of those things. How do I cram in the rest when there's not enough hours to do? So I think it's hard to see that light at the end of the tunnel. It's hard to kind of see that direction. So I remember that being the hardest part. I knew residency was next. I knew there was a match process. I had a vague idea of how all that worked from the people that had gone through it before me. But really understanding how things kind of crystallize and finish on the backside was tricky. And so that's the part I remember of just trying to survive day by day, hopefully thrive day by day, and then be successful with what you wanted to do.
Yeah, absolutely. And so, like, on the flip side, what was the most rewarding or enjoyable part of it?
I think there's that sense of accomplishment when you put in a lot of hard work, right? Every medical student has studied, hours and hours for a test and, hopefully mastered that topic. You're never going to get every test question right, but you're going to, come out the other side knowing a lot about how to care for a patient or how things work or how things go together. And I think that satisfaction of, putting all those pieces together and taking a complete H&P or giving a family good advice on, what to do next with their patient needs and whatever it would be. So I think it's that looking back on what you did and that feeling of accomplishment, I think is pretty cool.
Yeah, no, it's amazing to like go through medical school and go through residency and get to this point. So definitely congratulations.
Thanks. Yeah.
So are there any things you wish you knew before going into med school or residency?
Again, another good question because it's been a while. I've been out almost 20 years in practice and in post-training. I'll spin that a little bit differently and tell you the best advice I ever got was when I was in college. And I was talking to my family physician. And this is PCP and telling him I'm interested in going into medicine and what advice did he have as a pre-med student and so on. And this is going to go in contradiction to what I kind of said earlier. But his advice was that there's no end. Never look for I'm finished because there's always something else that you need to do next. And so take it day by day. Take it, rotation by rotation. Take it year by year as you make your way through. And so the goal isn't to get into medical school, you're not done, right? The goal isn't to graduate medical school, you're not done. The goal isn't to finish residency, you're not done. So if you look at it like that and kind of, live in the moment and try to be better every day, I think that's the best advice I ever got and doesn't give you this race to the end where there really isn't an end. There's just a different thing you're going to do next after you kind of make your way through the stages.
That's amazing. So I know as a pediatrician, you obviously love working with kids. What is that one thing that kind of makes you get up the next morning and you're super excited to come to work? What is that big motivating factor?
Yeah, my job is varied, right? So again, most of my time is as the residency program director. So what I'm excited about is watching people grow during residency. I know you're a medical student. As others watching are residents, medical students, pre-med, somewhere within that spectrum. And the idea is that when you start residency, you don't really know very much. You actually know a ton, right? And you probably know a ton more than I do as an attending pediatrician. But you don't know a lot about doctoring, right? You don't know a lot about, hey, this patient has asthma, go write an asthma action plan. You can probably quote me all the pathophysiology and biomarkers of asthma and so on a test, but how do you write that asthma action plan and give it to the patient, right? Some of those doctoring type skills. So I love watching people come into residency that are super smart, know a ton of information, but know very little about doctoring and graduate in 3 years and kind of move on to that next stage of I'm now an expert in this field of pediatrics and ready to go on to the next adventure. So for my Resi program director job, that's what gets me up in the morning is to kind of watch people progress those 3 years where you're kind of on that timid, unknown side and you leave as an outstanding and competent pediatrician. From pediatric medicine, that's a whole different ballgame. And I think what I usually talk about is kids tend to get better. There's never absolutes in medicine, so there are kids who get worse and have tragic outcomes and bad things happen to them. But the reality is our job is to make kids better. Our job is to keep healthy kids healthy and make sick kids back to their their routine and what they want to do that excites them in life. And so that's what gets you up in the morning. That's what I used to work in the hospital, rounding on inpatients and getting that kid ready for discharge. You see them come in pretty sick. We see a lot of respiratory illness in pediatrics that gets kids hospitalized. So they're hypoxic, they're on oxygen, they're in respiratory distress, whether it's a viral infection or a bacterial pneumonia, whatever you do for your intervention, usually within 2 or 3 days you're sending them home. And the idea that you put in a lot of work and a lot of worry and a lot of thought about how sick they were and what could you do to make them better, when they have to leave the hospital. That's pretty awesome. And same thing in clinic. People come in with a different acuity level, but they're sick and they're worried, and they don't know necessarily as families what's wrong with their kid. Is it something serious or something not? And to have the knowledge to give the families advice that you're fine, go on your way, go back to school, or here's your intervention, here's your treatment. I think people come to us for that, and that's a pretty amazing privilege, and it's also pretty fun to get up every day and do that work.
So a bit more on like the serious side of things. You mentioned how sometimes kids don't always get better. There are some tragic outcomes, and a lot of that happens sometimes throughout medical school and residency for a lot of people. How do you recommend people kind of cope with that and move on from that? Because going through medical school, I know a lot of people deal with imposter syndrome or feeling like they're not good enough to be a physician or good enough or like going to be smart enough to help someone. And when these things happen, it can sometimes, bog them down. What is your way of coping with these things and these feelings of self-doubt that might arise, or that feeling of failure that comes with it sometimes?
Yeah, great question. I'm going to take that in two different parts. I want to talk about imposter syndrome first. There's something in medical education called the hidden curriculum. And those medical students that might be watching this, you've all done this. I did this. The attending asks a rhetorical type question. Do you know the vitamin D pathophysiology? What do? You just nod your head, right? You don't say anything. You kind of smile and nod your head because you hope you'll get called on, because no one wants to talk about the vitamin D pathophysiology and the how all the mechanisms work and how all the enzymes are tied together and so on. And so even though you don't know, you nod like you do, right? That's imposter syndrome. Everyone has it. No one really talks about it. Attendings, if you defined imposter syndrome as, do you feel comfortable in the care you provide every single patient? I would guess 99% of attendings would say no. They do not feel comfortable in the care that they're providing every single patient. They're comfortable with what they're doing. They know that I know this, and I'm going to make this intervention, and I don't know, so I'm going to call this expert in that field as they go through, but they don't know everything. And so a lot of attendings have imposter syndrome. We just don't talk about it, right? So if you're feeling imposter syndrome, to me, that's normal. That's what medicine is that there's a lot of ambiguity and a lot of unknown, and you have to be comfortable in that space. You have to swallow your ego sometimes and say, like, I probably should know what to do with these fluids, but I'm going to call nephrology just to make sure so this kid gets the best care as they go. Or I should know this antibiotic resistant pattern. I think this is what's going on, but I'm going to call ID to double check as you go through. Versus I know exactly what to do with the fluids, and I'm going to just knock it out and make this patient get what they need. So imposter syndrome has been a more popular word the last 5-10 years, somewhere in that window. And I think it should be normalized. I think everyone kind of has that feeling. So how do you tie that to patients that don't get better, or maybe things that would fall under the category of medical errors or mistakes or so on? I'll go back to advice I got in medical school, and it was from a guest lecturer, and he was talking about litigation towards physicians, malpractice suits, kind of things along those lines. And he was pretty laid back kind of guy. And he was looking at the room of however many medical students were in my class. And he was like, you're all going to get sued about 5 times in your career. As long as you practice good medicine, don't worry about it, right? And I don't think the 5 times part was true. Maybe pediatrics is easier. And knock on wood, not been sued about anything. I know in the adult and private world, it's a whole different matter as some of those frivolous lawsuit type stuff comes about. But his point is well taken. If you do your best job and work hard and try your best, that's about all you can do. So that's how I approach the wellness around bad things that happen or things that I feel like I could have done a little bit better on. The idea that I'm going to try my best. I'm going to give this kid the best care that they can provide. And if they come back in a week with something different, I'm going to try to learn from that. I'm going to try to take it better from that, but I'm going to know I gave that kid their best chance when they saw me. And so you can't prevent all the bad things from happening, and just try to learn from them. And again, give them your best shot. And if you get sued, you get sued.
Yeah, and that's really inspiring. That's some really good advice, I think, to hold on to. So we've talked a little bit about your responsibilities and outside of the hospital, and you're the director of the pediatrics residency program here. You oversee graduate medical education, and you also work in primary care. So how do you balance all these responsibilities with your busy career as a physician, and what got you interested in being a part of being a director and also being overseeing the graduate medical education?
Yeah, I'll start with that second part first. So I went to medical school in Kirksville, Missouri, in the osteopathic world. And I bring that up because the osteopathic world has kind of different rotation schedules when you talk about your clinical experience than most of the allopathic schools. You're in an allopathic school, you're going to rotate here at Children's Mercy, you're going to be forced to go to grand rounds and all the academic stuff that happens and all the specialists around to care for those kids. Same thing at your adult rotations as you kind of go through. Those happen in the osteopathic world, but not all the time. A lot of my rotations were just with a private doc, just me and that surgeon that had his own practice, and I would operate with him and go to his clinic and so on. So there's pros to that, there's cons to the allopathic side and so on. I bring that up because I rotated here at Children's Mercy as a fourth-year medical student doing an inpatient sub-I, and I fell in love with academic medicine. I fell in love with the environment of a children's hospital. And I can get the same thing in an adult hospital, but just the environment of there are 800 specialists here who are, if you pick up the phone and say, I've got a question about a sick kid, they will stop what they're doing and they will help you take care of that kid. If you're interested in a research project, you'll network your way through the experts that can navigate that question you're trying to answer as part of your research. And so I fell in love with that, with the grand rounds where the experts coming in to share their knowledge and all what happens at an academic children's hospital. So I knew I liked that. And then when I was doing my residency, I liked the education, the medical education part of that. How can we take people who are really smart, who don't know how to be a pediatrician, and train them over 3 years to, again, be that outstanding pediatrician? So I was attracted to the academic medicine and then was attracted to the medical education piece that academic centers have through the residency programs or whatever else it may be. What was the first part of your question?
The first part of it was how do you balance all these responsibilities?
Oh, yeah. Great question. Wellness is a word that's super important. It's also a word that is undefined because how I balance my wellness versus how you balance your wellness, two totally different things. And I'll tie this to work-life balance, I promise, because I think that's what the question's getting at a little bit. But the word wellness is how do we balance, right? How do we figure out how we're going to manage all of our responsibilities? We all could use a 30-hour day and not a 24-hour day to do all the things we want to do. It's the Chiefs opening football day today, so I'll be watching that game. I got my Chiefs shirt on underneath here as we go, so I will not be taking any work with me home today. Tomorrow I may, right? As I kind of find that balance and find whatever that wellness is for me, because it's definitely Chiefs football in the fall and in the winter. Mm-hmm. And so as that word becomes more popular, how do we maximize that? And again, I'll give another dumb example about how everyone's wellness is a little bit different. But years and years ago, somebody wanted to have their residents here do yoga during their noon conference. That would really help their wellness, clear their mind from their clinical responsibilities. And you may think that's a great idea. I'd love to get some yoga done over my work day. I would have to be drugged, kicking and screaming to go do yoga at all, let alone do my work day when I want to get some work done. So your wellness is very different than my wellness as we go. So I like the term work-life integration. My kids will call me while I'm at work and we'll deal with some things. I'll head to their events during work hours if I can. And at night, I'll go to their games and their things, and I'll also get work done, depending on how all that plays in. And I think that's where the balance comes in. I think knowing that, when you're busy, you got things to do in the evenings, and when you're not, you can find time to do it, things that are more in your personal life. And so if you find a job you like, right, if you find something that you're really interested in doing, it makes it easier to integrate work at home and home stuff at work.
Yeah, absolutely. Okay, so just moving on. So Dream Journal, as you know, is an organization that's purpose is to spread the importance of evidence-based medicine and make research more accessible and easy to read. So what is your experience in evidence-based medicine, and why do you think it's important?
Yeah, I am hugely biased towards evidence-based medicine, but I'll tell you some more details of my story a little bit. So I did my pediatric residency here at Children's Mercy. I stayed on and did a chief resident year. So obviously I like that academics and wanted to have additional year in that kind of leadership role. My first job then was here at Children's Mercy, and one of my mentors was starting our Office of Evidence-Based Practice and gave me part of my job, so 25% of my job, to work with him in that area. And the primary work that we did was to build clinical practice guidelines around kind of common conditions and follow evidence-based medicine. And so we would scour literature, we would use our medical librarians, we would review the literature and score it based on the quality of the paper that we were reading, and we would then get a group together of experts to write a clinical practice guideline based on that evidence. And I love that work. I love because the majority of answers for patients are in the literature somewhere. And you can write a guideline so you can standardize outcomes for kids, make sure kids are getting great care. One of the more successful projects I was on community-acquired pneumonia, and something that had a lot of variability to it. And depending on which doctor your kid got admitted to, you might have got a different antibiotic or a different treatment option. And so following the evidence, reviewing the evidence in a critical way led to a guideline that standardized care for the majority of kids so the outcomes can be maximized. And then I'll put a spin on this because we always use the 80-20 rule, in that if you have a kid admitted to the hospital with community-acquired pneumonia, 80% of the time, they're going to follow that guideline. And to be perfectly honest, it's not that hard as a doctor to do that, right? You just kind of follow the guideline, ampicillin here, here's how many days, here's the dose, do I get a blood culture, yes or no, so on and so forth. The fun part about medicine is the 20% margins, where the kid doesn't follow the guideline. You know, most of the time we do X, Y, and Z. This kid's a little bit different. How do I think critically about a patient that doesn't follow what the literature's saying, but has bits and pieces that does? And that's what makes kind of the art of medicine piece, come into real life. And so I love evidence-based medicine for both of those. For the guideline that standardizes the majority of patients, but the patients that are out of that norm that you get to think about and kind of decide how you're going to best care for that kid. And so I did a lot of guidelines we developed for the hospital. I then became kind of the self-appointed evidence-based medicine teacher for the residency program. So we did a lot of journal clubs teaching people how to critically appraise an article. I know the website's talking about evidence-based medicine, and so some of my pet peeves are just because there's citations doesn't mean it's evidence-based. Evidence-based medicine is really looking at an article and saying, is my patient follow what this article was studying? Is it the right age, the right inclusion criteria, the right the way they approach the study? How much bias did they have in their work? And so, can I apply that paper to the patient in front of me, or the group of patients, or the guideline that I'm looking at? And so, I got involved with that, and that's probably led me to this job. Is that I was lecturing the residents a lot and got more and more involved with residency education. So, evidence-based medicine was what got me kicked off.
No, that's wonderful, and especially for people watching this and who know what Dream Journal is about, that's really amazing to learn more about why this is so important. So it's great. Cool. Thank you for sharing that.
Yeah, of course.
So finally, just to conclude, do you have any last minute tips or advice for medical students or pre-med students that might be watching this?
Yeah, great question. I think the general advice is something that I said earlier around find your passion. Right? Sure, medicine, right? Maybe sure, pediatrics, but find what's going to make you tick, what's going to make you excited about, being paged at 2 o'clock in the morning, or studying something in medical school that really has nothing to do with your clinical practice down the road, but is just building that base of knowledge that you have to be successful. And so find that passion. At the same time, nothing's perfect, right? There are parts of pediatrics that I don't like. There are parts of surgery that surgeons don't like. There's parts of, you name it. Nothing is perfect. And if you can find that passion, that majority of it is what you're excited about, the rest comes easy.
That's wonderful. Well, Dr. Newman, that's all I have for you. Thank you so much for your time.
Glad to be here. Thank you.